Good afternoon, everyone. Welcome to the Friday seminar. I know you missed me from last quarter. And last quarter, one of our star speakers couldn't make it, so we asked him to present this quarter. So we're bringing Freight back this quarter to the Friday seminars. I know you wanted that. So it's a really great pleasure today that I have Miguel Figliozzi, Professor Miguel Figliozzi from Portland State University as our speaker. Miguel is an expert in transportation, logistics, modeling, simulation, and basically e-commerce. So a lot of my work have been inspired by Miguel's work. So if you have taken my classes, I've mentioned Miguel several times, and in fact, on Tuesday in my Freight class, one of the groups basically reviewed one of Miguel's paper, and they didn't figure out that he was our speaker today. So Miguel works in, again, logistics, transportation, working with fleets, working with state, regional, federal, and other organizations looking into the impacts of transportation, emissions, and equity, and have pioneered many different type of methodologies to assess those impacts. Today, it's going to be talking about the work during COVID and commerce, and especially the important topic of equity. So, Miguel, thank you so much for being here. We're really excited about your presentation.
Thank you very much. Very, very kind and very nice words and introduction. And I hope the students like the paper. And if you found an error or a problem, let me know. I'm always happy to change it. So today, I'm sorry I cannot be there. I wish I could have gone to Davis, but unfortunately I have to attend some important issues here in Portland. So thank you for attending this presentation. And basically today I'm going to be talking about some of my research in our group that is related to e-commerce and more specifically about equity and the relationship between equity, accessibility, and e-commerce. And of course, a lot of the work is not just mine, and I have to start acknowledging the contribution of some of my colleagues. For example, Avinash Unikrishnan, he's a colleague of mine in the civil engineering department, and here we're going to be basically talking about two papers I did with him, one published in Transportation Research Part D and the other one in Part A. And they are both related to results from a survey that we did in Portland, in Oregon, during the COVID lockdown. And I also have to acknowledge other colleagues, in this case, Pani and Savia Mishra, also very good friend, Mike Golias from University of Memphis, where we did a bit of work on looking at the acceptance of autonomous delivery robots during COVID. And I'm just gonna talk a little bit about some part of those results related to equity. And finally, some work done with a great grad student, Jacqueline Schaefer, and we did a work looking at spatial accessibility of Amazon lockers in our city. So I'm going to be roughly, covering different aspects of these papers, roughly following, the presentation, the papers that in the order that I have presented here in the slides. And I want to do that just in case later on want to, find more or just look more into details. You can go to the papers. Of course, you can contact me. I'll be happy to expand or clarify anything that maybe didn't make sense in the presentation or the Q&A. And finally, I would like to acknowledge the Freight Mobility Research Institute and my funding for working on these papers and some of the grad students was funded by this transportation center housed at Florida Atlantic University. Starting with the presentation, I guess we all know, just a bit of context. We all know that e-commerce has been growing very fast. It was growing before COVID at roughly 10%. And this slide, it's hard to see some of the numbers, but basically in the darker blue, you see the projected growth before COVID, for 2020, 2021, and it was roughly 9-12% projected to grow, and COVID added the 19% and 22% for 2020 and 21. So you see like a 10% growth is super high, and just, with COVID and the lockdowns, this moved towards e-commerce has really accelerated, and it's becoming much more important by the day. So that's kind of the context and part of what motivated this. And the other thing is, we look at the US, and there was similar boost in the pandemic in terms of e-commerce, but there are some categories, for example, groceries and food delivery, that the growth was very, very amazing, in the sense like it was 100% growth comparing 2020 and 2019, for example. So obviously there have been some higher demand for some consumer products, after people got their stimulus checks and got some dollars from the federal government and stopped spending on travel and restaurants. There was more money to go towards home repairs, furniture, other consumer products, but many other essential products like food, medicines, groceries also increased at a very, very rapid pace. So given this kind of super fast growth of e-commerce, the motivation for the talk today and some of the work we have done is e-commerce and home deliveries is just not something that used to be, like in the past, something like a nice option or luxury, or something like, it's more comfortable. But for some people, especially during the pandemic, and given for different health-related issues or family problems or work-related conditions, becomes an essential service. And I think that's part of what I want to convey in this talk, is like, we should start thinking about home deliveries and e-commerce as an essential service, and thinking that accessibility is not just, being able to reach destinations, for example, key destinations like going to the hospital or going to access education services or shopping, but also how possible is for people with in different conditions, different groups, to be able to receive home deliveries and services. And as we're going to see, not all households are equal in terms of access to home deliveries. And hopefully, as I go through the slides, I will try to make the case, why we found this in the data. Just to start with, some of the initial research questions were related to basically three ones. So basically, we wanted to know what type of households have 0 home deliveries before the lockdown. Then basically to say, well, how did the COVID-19 lockdown affected the type of households that receive home deliveries? And finally, what could be the implications of no access to home delivery services in terms of equity and environmental justice? Yeah. So to answer the first questions, we did exploratory and confirmatory models, utilizing data from an online survey. And it was very important. We took a lot of care and made sure that the survey was representative of the population in the Portland metropolitan region. And we did some very careful modeling that I'll try to explain in the next slides. So going to the data collection, this was an online survey. And of course, at the time, this was, I'm going to expand a little bit, it was during the lockdown, so it was impossible to gather data in any other way. So it was an online survey. The timing was the last week of May, first week of June. And this is very important again, because it was right after the beginning of the very strict lockdown in our region. I want to say that we received 1,015 complete observations. So this is the sample size after cleaning and consistency checks and complete. So every complete answer was included in our analysis. And then we made sure that we follow some population quotas based on the literature review. And then we had many questions where we have more details in the papers in terms of social demographics, attitudes, delivery rates, etc. To give you an idea about the region, so we just focus on what is called the Portland-Vancouver MSA, the Metropolitan Statistical Area, that comprises 5 counties in Oregon and 2 in Washington. You see here in the map is between Oregon and Washington, but based on the zip codes of the respondents, we saw that most of the respondents were, in the urban, suburban area surrounding downtown Portland, basically in what I'm showing here with my mouse. So I mentioned before that the timing of the survey was last week of May, first week of June. And I think that it's important to just give you some idea about the timing in Oregon of the lockdown. March 8th was a state of emergency, restricted gatherings March 17th. March 23, the government said, stay at home, and the schools closed. And these conditions were extended in the hardest lockdown until July the 6th. So we were lucky that we were able to prepare the questionnaires and be able to receive the data during the the hardest part of the lockdown. So in a way, it was great to get responses while people were really going through this difficult period. And to show that the lockdown was really strict and important, we could see from traffic volumes from the automated counters on freeways that the traffic was down 40 to 60% in May. And obviously there was no congestion. It was very different. It seemed like we were in a different city. Actually, now everything is back to normal. We see congestion all the time, every day. But back then it was very different. I mentioned before that we really, based on the lead review, really wanted to make sure that we had a good survey and a good response. And that's why we emphasize having over 1,000 complete answers. And also we're very keen on, based on the literature, to have quotas for these 3 very important demographic factors related to gender, income in different levels from the lowest to the highest, and also age, because all these 3 factors tend to be very important in terms of e-commerce adoption and e-commerce expenditures and delivery rates. To give you a sense of some of the descriptive statistics of our sample, we did a lot of work trying to make sure that the sample was representative, and we are lucky to see that that was the case. And if you remember that roughly we had a little bit over 1,000 responses, when you see here, for example, 40% for male, that means that we had roughly 400 respondents that identified as male and 600 as female. And for example, when we look at income, even with this 10% for the lowest income bracket, that is less than $10,000 per household, that is equivalent to a little bit more than 100 observations. So even in the categories where we didn't have a very high percentage, given that our sample size was pretty large, we still were able to, when we estimated the models, to see significant results for some of these variables. Something else that that we were keen to see, that we had respondents in the different age brackets, and we got a fairly good distribution. And obviously, it's harder to get online responses from people over 65, but we managed to have over 150. And also that it was kind of important for us was, it was not in the quota, but to see how many hours people spent on computers or a smartphone, because that's clearly related to working from home and also access to technology. And nowadays it's getting harder and harder, but we had like at least 50 respondents that had 0 to 3 hours per week on utilization of computers and a smartphone. Is something that is, getting harder and harder to see, because most people, tend to spend many more than 3 hours per week on electronic devices. And the other thing that was very important, and we were very lucky to include in the survey, was this variable that is called delivery subscription, that turned out to be very, very important in the results. So basically in our sample, roughly 30% of the sample, 300 respondents, did not have any type of delivery subscription, while 70% had some kind of subscription, that could be Amazon Prime, it could be a food delivery service, or could be a grocery delivery service. It could be any type of subscription, and that turned out to be a very important variable. Just continuing with some statistics, just to give you a sense that the data was solid and made sense. This household distribution, typically we saw a lot of 2-member household respondents with 1 to 2 workers per household. The number of elders tend to be low, again, because we saw like it's harder to get the over 65, but we were lucky enough to have households with, elders in meaning over 65, at least like 200 observations. Households with children, defining children with less than 12 years old. We were approximately counting 1, 2, 3 or more children per household. We roughly had over 200 observations, and then you see the vehicle count distribution, where we had over 100 observations with no vehicle in the household, and then most of the household had 1 to 2. And the other variable that was a bit a surprise as how important it was the question about disabilities, if members of the household had any type of disability. And of course, there are many, many different types of disabilities. I'm just showing here the overall response, and roughly 18% of the households had 1 member or more with at least 1 type of disability. We also included questions to try to gauge a little bit the attitudes regarding online purchases and type of products. And I think it's, you see here, for example, in this liker type, responses, from 0 being a topic that is not relevant or the least relevant, to 5 being the most important or the most relevant. We see here that time of delivery, at least for our sample during COVID, it was the kind of the attitude or the question that had the lowest number of highest rating with 5, while online health was much more important and cost was the most important ones when we look at ratings with 5. Yeah, so we had, like I said, this type of attitudinal questions, and then we had questions about the type of product, and I'm going to talk about that later. And then I want to show some preliminary equity indicators that show some relationships between the variables that we collected from our sample. And I apologize for the table that has a lot of numbers. Just to kind of direct your attention, I'm just trying to highlight some numbers here with these kind of red circles. And I just want to mention that income, of course, it's a super important variable, not just for e-commerce, but also to think about equity. And that's why I'm presenting these variables in terms of how income is affecting, for example, race. And we see the breakdown that in the lowest, the poorest households, they tend to be mostly African-American or Hispanic, Latin American origin. Well, if you go to the other extreme, greater than 100,000 in terms of income, they tend to identify as white-only households. The same could be said about the educational level, very, very strong correlation between less than high school education attainment and very low income level with a 71.4 here in this corner. And then if we move to the grad or higher level, we see that 53% would be in the greater than $100,000 per household income. And the same thing could be observed in terms of vehicles per household. Low-income households tend to have many less vehicles or zero vehicles. And then higher income households tend to have many more vehicles. So you can see already that there is a lot of correlation between the variables. And that's something that, had to be taken into account in terms of the modeling, because obviously when you have very strong correlations, you cannot just add all the variables to the model directly. It requires a little bit, more sophistication than that. Moving on, something else I would like to show is this connection between income and delivery subscription. Again, on one extreme here, we see that people with the lowest income, we see that no is 18.4 versus the yes is 6.1. So it's basically almost a 3-to-1 ratio when we compare the two percentages. If we go to the other extreme, to the greater than 100,000, we see that 13.9 and 34.1, that kind of 3-to-1 ratio is almost reversed. So again, income has a lot to do in terms of with the likelihood that the household is going to have a delivery subscription. And that's in turn is going to affect number of deliveries and expenditures at the household level. We also wanted to compare pre-COVID and during COVID delivery rates. I'm here just highlighting some numbers here, like for example, you can later see more of these tables in the paper, but you see that before COVID, for example, with the zero level, meaning no deliveries, there was a fairly important number, in this case, 18.8 for households in the lowest income bracket. But it's interesting to see that even though e-commerce grew so much with COVID during the lockdown, we see that the zero delivery rate for some household with very low income went from 18 to 27. So you could see that this kind of the adoption of e-commerce and deliveries are not evenly distributed. You can see here just in these kind of tables that there is something going on in terms of income and how people were able to get access to home deliveries. So actually, in this case, we see that in these numbers that the number for zero went up from the before to the during the lockdown for very low income households. And that's something that we were not expecting. We thought it would be flat or with no change, but we would not be expecting, and it could be, it's hard to, to prove this, but there could be many hypotheses, for example, that people unemployed, someone just didn't have a job. So maybe before was buying things online, but losing a job, that meant that that person or that household had to stop purchasing online, for example. There could be many other potential explanations of factors. I'm just trying to provide some potential ideas in terms of what might be reflecting this number from 18 to 27. So overall, major changes in home delivery rates. We saw that in our survey between before and during COVID, during the lockdown. A conservative estimate is like during the lockdown in our sample, house deliveries were 53% higher than before the lockdown, just looking at the overall population, just using weights and trying to extend this to the whole population in the area. Just going to the tables, thinking about, well, who really changed behavior in terms of before and after. And here we have different brackets in terms of number of deliveries here in the left column, and the range from 0, meaning 0 deliveries, 1 to 2, 3 to 5, 6 to 10, more than 10. And then we have the first two columns here in the center before COVID-19 with the frequency that sum up to 2015, that's our total sample, the percentage, and then during the lockdown, again, the frequency that sums up to the same number and the percentage. And then here, just to facilitate the comparison, looking at the difference before and during. And we see that, for example, for 0 deliveries, it was a slight increase. There was actually overall not a big increase in the number of households in this group, but we saw a big decrease in the 1 to 2 and a major increase in the 6 to 10 and more than 10. And we can see this a bit better in the next one, where we have the cross tabulation. And here, this is also useful to see that there is some stickiness, meaning that there's a very strong correlation in terms of households that had 0 delivery before had roughly 50%, likelihood to have 0 during the lockdown. And then if you go down the diagonal, you will see that these numbers are pretty high. And if the highest one, if household had a 10 or more deliveries per month, then during COVID, it was, very, very likely that they will have that same number or higher. And the other thing where we can see this shift is like, if you see that in this diagonally moving up, where we see the 43.8 and 41.3, that we see that moving from 1 to 2 to 3 to 5, and from 3 to 5 to 6 to 10, and so on. So the numbers are kind of shifting up and right. So I have been hinting that during our exploratory analysis, we used order logic models because obviously we didn't know what to expect. But quickly we found out of course, there were a lot of correlations and a lot of potential endogeneity in the between and before COVID and during COVID in terms of error terms. So in our analysis, we decided to do the exploratory part first, and then we did the confirmatory model using latent variables, factor analysis, and the simultaneous estimation of the whole structural model. And here I'm going to show you just a little bit of the flavor of what was the model in this case for this first set of results, just trying to unpack a little bit. So basically we had the final choice. The most important was, for example, did the household receive or not home deliveries? That would be a binary choice. But because we had the before and during, it was kind of in a panel structure because the same household was responding before and during. And that decision process was affected by socio-demographic variables like income, household size, members with disabilities. There were attitudes that are also affecting this decision process. And also we included the subscription variable as a latent variable that was in turn affected by socio-demographic variables. And in turn, the subscription variable was affected by an income latent variable. So you see that income is very, very important because it's upstream in the chain, and income is affecting subscription levels, and subscription levels is affecting the decision process of the household in terms of the number of actual deliveries. So just to show you some results, I would like to, for example, show here that after estimating the model, again, the results I'm going to show you are not part of the exploratory part of the analysis. You can see that when you look at the paper, but here we are looking at the jointly, simultaneously estimation of all the parameters for the before and during lockdown, using all the data. So it's panel choice data for before and during, including the social demographic variables. And again, we are doing this binary logic delivery model, looking at households receiving or not deliveries during the lockdown and before. Trying to show you some results now. And this is the income submodel. If you remember, this is the model related to this part of the structural model, the income. Then I'm going to show results for the subscription, and then I'm going to show results for the binary home delivery choice model. I'm showing here some of the results, and you can see here that the coefficient, the t-value, and the probability of being significant, you see in most cases for all the variables, very highly significant. That's in part given to our large sample. And you see for income that higher education obviously makes a big difference. And we have a positive coefficient, the same with age. So meaning that the older the household, the more likelihood they tend to have more money. Male also has a positive coefficient, and number of household workers. And something that it was very interesting to see, and it was highly significant, is to see that households with members that had a disability or a special need had this variable and had a negative sign. So meaning that in terms of you think about equity and accessibility, perhaps this is already saying that the households that may need, in some cases, due to health or mobility issues, the most to be able to access home deliveries may not be doing so in terms of income limitations. So to make sure that our results were strong, so we did models looking at 0 deliveries, meaning like the household is having a delivery or not. So in this case, what are the likelihood of having a delivery? Obviously, more education is more likely to have a delivery. That's the way we should understand these coefficients. But then we also compare with what are the households that tend to have deliveries over the median delivery rate. So in this case, the question was 1, if the household had a delivery rate over the median, and 0, if the household had a delivery rate below the median. And you see here that it's pretty good. We're very happy to see that the model is fairly robust, because you see even the coefficients that tend to be fairly similar, 1.06, 1.04, 0.03. So we can see that they are really in the same order of magnitude, and we didn't see any change in sign or any big variation, even in the magnitude of the coefficient, that it was a good sign in terms of having this result for 0 delivery households, are also extended for households with the median delivery rate. Moving on now to the other submodel, we're looking at the delivery subscription submodel. And in this case, I have highlighted just a few variables that tend to have the most significant coefficients, and to have a delivery subscription that some of the explanatory variables was hours with electronic devices, over 40. Clearly that's highly correlated with working from home. So people that are able to be connected and have access to electronic devices over 40 hours per week, you know, most likely they tend to be in a white collar job and not in a blue collar or a job that requires more manual labor or, you know, less utilization of electronic devices or computers. It was also interesting to see that for transportation people, to see that auto travel to work was also positive and highly significant, whereas bicycle travel to work tend to be negatively affecting the likelihood of having a delivery subscription. Household size also kind of expected to have a positive sign. And then the income variable, latent variable, of course, had a positive value. And then we had some factors from the factor analysis looking at essential products and non-essential products. And in both cases, they were significant and positive. Whereas the factors related to attributes of brick and mortar stores and online deliveries, they were not really that important. And again, the findings and the kind of the sign of the coefficients were comparable pretty much, obviously in this case, a bit less than the previous case, but they were pretty comparable when we compare with the delivery for more than 0 household deliveries per month versus deliveries over the median rate. And finally, I'm going to show some of the results related to the actual delivery rate. In this case, again, the 2 results for more than 0 or over the median. And again, I'm highlighting some of the variables that were significant. So working from home, again, positive and significant. Again, that's kind of an indication that households that have members that tend to work outside the home, less likely to benefit from e-commerce and home deliveries. White, anything, you know, just only white as an identification had also a positive and significant result. Subscription, of course, was very, very important. And then the factor 2 related to non-essential products was also very, very significant and positive. So meaning that in many cases that having a delivery rate over 0 is related to, you know, receiving products that are not essential. And by essential, we meant food, groceries, medicines, and health-related items. And here I'm not highlighting everything, but on the delivery over the median, one variable that was different was this hours with electronic devices less than 3. And it kind of makes sense that people that tend to have very low exposure to electronic devices throughout the day or the week tend to have much lower delivery rates. And so what can we say from trying to summarize? Just a quick summary of everything I have been discussing. We could just condense it into these 6 points. So basically, groups less likely to benefit from home deliveries and e-commerce tend to be low-income households, households with lower educational levels, a small size of single-member households, households with less access to electronic devices or the internet, households that do not usually commute by auto or work from home, and non-white households. And I have to add that households with a member that has a disability are also less likely to benefit from e-commerce and home deliveries. That these results are, in a way, especially during COVID, kind of hard to, or interesting to contrast with these kind of environmental justice issues in terms of deliveries that generate traffic, safety issues, and air pollution tend to affect, especially the location of distribution centers and heavy movement of the fleets, tend to be located around low-income and minority neighborhoods. So it's kind of clear contrast in terms of who is receiving the benefits of e-commerce and home deliveries, and the people that may be suffering the burden of the traffic, the emissions, and potential safety issues related to e-commerce. So that's something to keep in mind, that it's obviously we are not proving here that there is a direct connection, but it's a connection that made with findings that other people in the literature have already explored. So in the paper, we're trying to say, well, if there is another potential crisis or issues in terms of people having to lock down or not be able to leave the home, or having potential health risks associated with brick and mortar shopping, we are discussing some potential solutions and ideas, and some of the things we're mentioning, you might agree or not. And at the time, it was the middle of the pandemic, we were thinking about some proactive solutions. For example, some agencies being able to map underserved users populations and then potentially partner up with logistic companies or the postal service or transit agencies or other entities in a way to do socially responsive logistics and deliveries, to try to be able to get and provide access to some people that may not be able to do it, especially during a pandemic or a crisis. And by the way, some transit agencies, for example, the one TriMet here in our region, for their paratransit service, during the pandemic, they started this service where they would be able to, instead of taking people to grocery shopping or to supermarkets, for example, they will have the paratransit vehicles to act as delivery vehicles. Basically, the regular uses of paratransit services were able to request certain essential groceries and products, and then people working in the paratransit service would deliver to home. Like, instead of having Amazon or FedEx or UPS, there would be the transit agency providing that service, and obviously was very useful for people with mobility impairments and very elderly people. So, of course, other solutions is not just transportation, it just requires the e-commerce and home deliveries, require internet service, electronic devices, online literacy, and it's important to remember that some households, for example, may not have access to credit cards or may not be able to buy online because they don't have the financial tools to be able to access to some of these services. So just to keep in mind that there could be different barriers that sometimes in the transportation area we are not too familiar with, but for example, there could be also barriers in terms of visual impediments, or people that are not able to use keyboards or navigate the websites of different companies that sell products. So it's something to keep in mind, that there could be barriers that we traditionally do not think about when we talk about transportation. So that was part of our work and focusing on equity and deliveries, but part of the work also look at the impact of product type and attitudes on delivery rates and expenditures. So why we wanted to do that? Well, I don't know if you have noticed, but if you try to work on this area, you will quickly realize that it's very hard to get data in terms of household deliveries. And obviously, private companies do not want to share data, and basically you have to get your own survey, collect your own data if you want to analyze this type of issues. But in terms of expenditures, there is a lot of data, and actually very frequent and pretty accurate data. For example, online companies report credit card transactions, or they report the Department of Commerce. They have very good estimates in terms of e-commerce rates, in terms of per quarter. So it's very good to see that there are options in terms of being able to track the amount of money spent on e-commerce and home deliveries. So that's why that was the motivation to try to see, well, what is going on? Is there a way that we could use expenditures, the amount of money spent, to have a pretty good idea as a proxy for deliveries? So to do that, we analyze the data in a different way. I'm showing here some factor loadings. Of course, we had to do some latent models and to account for correlations. We did factor analysis. And I want to show you here that in the factor analysis, typically you tend to see groups of variables, like, for example, grocery and meals, that we call it food related, electronics, fashion, beauty, personal care products, recreational items, household office products, medicine, health products, that we can call it consumer. We put the label consumer products, home delivery attributes like cost, time, online experience. But it was interesting to see that health and safety, so in terms of how important respondents felt in terms of health and safety, that was a factor on its own. So it was pretty interesting to see that it really stood out as an island. And we wanted to see, how that connected in terms of product frequency, delivery rates and attitudes. So we had 7 different product types and 4 different attitudinal questions, and we analyzed segment or clusters of households based on how low delivery rates and expenditure level. Again, we use this kind of binary latent model with the panel structure to get the results. And I'm going to show you some of the results here. So basically, we tried to group respondents in different buckets. So here I'm showing the respondents' results for low delivery rate, high expenditure. Yeah, so low delivery rate is household that had the rate below the median, and high is because they have expenditure, the money spent is higher than the median level in our sample. And it was interesting to say that you could have high expenditures, a lot of money spent, but low delivery rates. And in this case, only the factor that was significant and was the only one was consumer products. And then you can see that that's basically, driving very expensive items, like would be electronics, for example. You don't need to have many delivery of electronic products, for example, to have a very high amount of money spent on e-commerce and home deliveries. And we see here that the usual suspects, subscription was very, very significant variable. And here with the 2 stars, meaning that is P less than 0.01 and 1 for less than 0.01. So you see that there are very significant mid and high income, and you see the relationship with high income having positive but higher than mid income, age negative as expected, and household size positive, and again disability being, like all things equal, members with households with a member that has a disability tended to be more in this category. If we move now from this low delivery rate, high expenditure, looking at high delivery rate and high expenditure, we see that besides the consumer products, now we have two other factors that are significant: health and safety. And it's interesting to see that it's a very high coefficient. We see 2 versus 0.7 and 0.6 of the other two. And the other thing is health and safety is basically related to high income and age. So in a way, in a simple way, we could say that the households with the most money and that tend to be older, they were the ones that really put in a lot of weight on the health and safety factor. And that drove this, part of this high delivery rate, high expenditure. And on the other side, food related, and that it was also positive. And again, in this case, the subscription was significant, meaning that if you have a subscription, you tend to use it a lot, and that kind of results in high delivery rates. Age was negative, meaning that older in this case is the opposite of the age we see here for the health and safety. And you can see the complexity now that, in some cases, age, when relates to health and safety, tends to be a very strong driver. But when it relates, for example, to food related delivery, age is also a negative factor. And then members, household with a disability tended to have a positive in this case too. So, and finally, I want to show you this, the other case that is high delivery rate and low expenditure. So meaning that households that receive a lot of deliveries, but they don't spend a lot of money. And in this case, it was interesting to see that this other factor, home delivery attributes that relate to time and cost, were significant. And you see that, again, subscription tend to be a very important variable here, income and age again. The other thing I wanna highlight in the previous model with the high expenditure is like in this box where we have related to health and safety, we have income and age. It's the only case where the subscription is not a significant variable. So it's interesting to see that the subscription was a very, very important variable across the board, except in the case of health and safety when it relates to high delivery rates and high expenditure. High expenditures. So that's kind of a bit of a summary related to that work with that survey during the lockdown. And I just want to quickly switch gear to just mention the other paper that I have worked on with my colleagues from the University of Memphis. And in this case, we were looking at willingness to pay for home deliveries, utilizing new technologies. And basically, the question that is relevant for the presentation today, it's, this paper has many, many more aspects that I'm not covering. I just want to focus on just a little bit of some of the results in terms of they are connected with equity. And basically, willingness to pay in trying to say what type of households are more likely to pay for deliveries when these deliveries are going to be, being done by new technologies. And in our case, we're focusing on autonomous delivery vehicles, and more specifically on sidewalk or on-road delivery vehicles that will not have a person, but may have the advantage of being able to provide more frequent delivery faster, for example, in the next hour, or deliveries at times that tend to be non-traditional, for example, ordering food or ordering some products and be delivered, later, like say in the evening at 7, 8 p.m. or 9 p.m., 10 p.m. So meaning that having that kind of autonomous option provides more flexibility in terms of being able to deliver anytime, all the time, to households that really want and value this type of service. And just to kind of give you a quick overview of the models we were using here, and again, I don't have the time to just go into too much detail, but basically we had, like it's done in many research papers, with the statements trying to measure shopping attitudes of consumers that we can later use having the responses in this 5-point Likert scale to be able to group and cluster customers in different with different labels. And I'm not going to get into the labeling in this case. I'm just going to focus on the willingness to pay because that connects more with equity. But to give you a sense about the statements that we're using in this paper, it ranged from, I like having merchandise delivered to me, meaning that positive attitude towards e-commerce, find it hard to judge merchandise quality on the internet, meaning negative approach. I like not having to leave home for shopping. Again, that positive aspect of e-commerce. I use internet shopping mainly because of the COVID-19. Again, that related to the specific circumstance of COVID. I like that car is not necessary in the case of internet shopping. Again, that convenience. I like the helpfulness available at local stores. I'm trying to measure people that prefer to buy locally and go in person. I think internet buying has delivery problems. Again, trying to capture people that have a negative perception of e-commerce, and I do not want to give my credit card number, meaning that people that have that are kind of safety or worried, about the online transactions. Just to give you again some idea about the model, but we had all these attitudes, and the 8 attitudes. We have demographical factors, locational factors. Again, it was a different survey, but we followed the same protocol in terms of being very careful in terms of the sampling, matching the quotas, and being very close in terms of the quotas that how we see that gender, income, age in the population in our region. And then we have latent classes of consumers that I don't have to go into detail, but also that kind of classes of consumers affected willingness to pay for autonomous delivery robots. And then we had demographical factors, psychological, attitudinal factors, and locational factors, meaning people living in the countryside or in the city or the suburb. And in this case, we use latent class cluster analysis to identify homogeneous consumer segments that, again, I'm not discussing in this talk. And the part that I'm discussing is we use also a contingent evaluation method to estimate willingness to pay. So basically, we use latent class topic models to get to this willingness to pay. So some of the results, and I think that's kind of relevant, and to see the connection with equity, the willingness to pay for these kind of new technologies, age is a very important factor, and across the board for all the classes, willingness to pay decreases with age, meaning that young people tend to be much more likely to adopt these new services. Income, again, has a very strong positive effect. Education, again, that highly correlated with income, has also positive effect. The other thing that had a positive effect was suburban location. So meaning that not people in the rural part, nor in the densest or downtown part of the region, but really in the kind of surrounding suburbs in between rural and the urban core. And the other thing that we were able to see in terms of, well, what about the people that have non-positive willingness to pay? And that we were able to see 2 different groups. So basically, one connection that is not really related to equity, like we call it the protest group. Basically, we can summarize that with a statement like, well, we feel like we shouldn't pay, no additional cost should be paid by government, and that the additional cost should be paid by someone else, not by me, that is maybe consumer. And that's kind of the attitude that we call that percentage of these people that have this reaction, like a protest group. And then what is relevant in terms of equity is to look at the genuine zero responses. That was typically in the sense of, I'm willing to pay and I would like to participate, but my income doesn't let me. So basically we see that was as a sign of there was, significant share, over 10% of the respondents that, were in that group in terms of zero responses, because they felt that they didn't have enough income to participate in this type of deliveries. So that's, again, that paper has generated a lot of attention, and it's been cited a lot. And I think it's interesting because it kind of makes you think about, well, how is going to be the future? Will new delivery technologies increase or decrease e-commerce home delivery, the gap for underserved populations? And so far we can talk more in the Q&A, but I think it's I think we can argue in the pros and cons of technology in terms of may widen or might reduce the gap. But anyway, something we can discuss in the Q&A. So finally, I just want to, before I run out of time, quickly just very briefly mention some research we did in terms of access to lockers. And basically in this research, we look at lockers, basically Amazon lockers that located in the right of way, not in private buildings, not in lobbies of buildings, but lockers like this one in the photo that anyone can go. Basically, they are like public. So why? Because they have been growing very, very fast. We have been lucky to be tracking this, the growth in our region of lockers and the distribution, the location. So we see that they are growing, especially the Amazon ones, in partnership with convenience stores mainly, but also with banks, hotels, universities, malls. That are being installed in many, many places. And the businesses get the promise of more foot traffic and business. And it's good also for Amazon because they have a more reliable and faster and cheaper way of delivering. And of course, have the potential for automation too. So the basic questions were how are lockers distributed with respect to accessibility, and what are the equity implications of the current distribution of lockers. So we look at many data sources to try to tackle these variables related to computer access, internet, the transportation environment, population density, type of housing, type of percentage of the mode split, some no income demographic variables, race, age, education, employment, and of course, income related variables. So the methodology we use Google API to find the locations. We use a lot of many different data sources from land use to all kind of data from the US Census Bureau. And finally, just trying to go a bit fast, but we ended up just plotting the kernel density function of the distribution of lockers. And in this case, on the left, we see that density of houses in relation to the distribution of lockers. And it's pretty, we did all the kind of spatial econometric measures to see the correlations, but it's pretty clear just looking at the graph. You don't have to see an expert to realize that there is a pretty strong connection between housing density and number of lockers. But then we started also, and again, I'm showing some maps, but not all of them, some grouping of, for example, grouping census blocks in terms of income with high income corridors that are pretty distinct with low income and mid-income. And then we started comparing them and overlapping the distribution of lockers in relation to housing density and all these other variables. And then we look at clustering analysis, and we were able to, for example, classify what I'm showing here on the right, 4 different types of groups in the region. For example, with this color here on top, high educated families that tend to be small and there are homeowners. In this other second one, more older, retired, living alone. The third group with highly educated, younger, working adults. And the fourth one, looking at Hispanic, Latin American origin, larger families, least educated. And you can see, especially for the last group, the Hispanic one, that tends to be very high correlation with the low income distribution. So we analyzed accessibility in terms of how many people can access by mode, for example, looking at different ranges. So if you have to walk a quarter mile or a 5 mile, or you are biking or you are driving different distances, what percentage of the population could be able to reach a locker? And we see that, for these 4 different categories, for example, we have the numbers. Like if people are driving, they get almost 99 to 100% in most cases, except in more the rural parts. But if people are walking and they don't have a vehicle, that number is much smaller. Yeah. And also we compare densities in terms of lockers per square mile, per population, per households. And, we have many other metrics, but just going to the key findings. So lockers are accessible by auto for most of the population. But again, it's could be a challenge for people that do not own a vehicle to access one of them. And especially for Hispanic, Latin Americans, people with low education may have even less access. So we're working now on extending this research and some connections. We have very good data in terms of public transportation in the area, and trying to link car ownership and transportation, public transportation, transit use, and package delivery. Also looking at safety issues, new technologies, and basically working with how government can use these findings. And just wrapping it up, I just wanted to conclude with this concept of thinking about home-based accessibility as an idea that I think in the transportation community we should start thinking more about, because typically we think about we need especially underserved populations have to be able to access education or hospitals or places of recreation, but I think we tend not to think in the same way in terms of home deliveries as a basic service that have become very, very important for some populations that, especially again, could be at risk, obviously during the pandemic, but in general. And just thinking about home-based accessibility as this ease of accessing essential home deliveries or products such as groceries, medicines, without leaving home or accessing them at a nearby convenient location, for example, a locker. So again, it's not like the delivery has to be at home, but for example, lockers could be a way to reduce cost. For example, in Poland, where we have an extensive network of lockers, it's cheaper, for example, to get deliveries at the locker than to get the delivery at home. So it's something to just kind of think about in terms of lockers tend to have environmental benefits in terms of reducing emissions and traffic, but also could be a great way to provide cheaper and more affordable e-commerce access to underserved populations. So again, this kind of thinking about home-based access as the reverse in terms of people going to places, thinking about products and services going to people at home. So the challenge is to ensure that essential services and products reach everybody, especially traditionally underserved populations. And just with that, I think I would like to wrap it up. And again, I would like to thank the support of the Freight Mobility Institute, and I'm happy to answer questions if we have time.
Any questions?
Yeah, so thank you so much for the talk. There was a lot of stuff to unpack in the presentation. When you mentioned the health and safety aspect in the first paper, was that something like, how did you, like, was that just something that like people used as a reason as to why they got home deliveries? I'm trying to tease that, like how that category came out so prominently in the research, and what does that mean, and why, like for example, why was it separated from, say, like medicine deliveries in the consumer product section, and are there some sort of like conflation of those two?
Mm-hmm. Yeah, that's a great question, and I think I can try to provide an answer. I think that this health and safety is more like an emotional response. And I think I think the respondents felt that that was an important factor or, issue that they motivated them to have more or less home deliveries. And I think that's some people may, for example, may already be buying groceries or medicines online, but given different demographics, maybe because they are young or because they feel healthy, that they are not so concerned about being there and potentially at risk going to a store. So I think it's a complex thing. It's not like not everybody that buys medicine or essential products online do this because they feel that it's unsafe, for example, during the lockdown to go to a store, but it could be for convenience, and that kind of makes it very difficult to tease out that, the actual cost of, factor behind it. So, but to be honest, we thought that people may be worried about the health and safety, and we included that because typically that was not being included in this type of e-commerce surveys. So on our part, it was a bit of luck to just be able to include this variable, this kind of attitude, as well as the one in terms of having members with disability. So just to try to be honest, that sometimes you have to be lucky in terms of what you're asking, and sometimes it kind of you get something that is surprising.
Yeah, thank you for the presentation. It's really interesting. I was wondering about the income submodel that you showed in one of the earlier slides.
Mm-hmm.
So income plays like sometimes like a U-shaped kind of relationship. It has a U-shaped relationship with deliveries. Like you see lower income households or ordering less, and then as income increases, the deliveries increase, but then when income goes really high, they tend to fall again. So do you think maybe like capturing this kind of non-linear relationship could be possible in one of the models, maybe like including a square term or something like that?
Yeah, that's a good question. To be honest, we're not too concerned about high income in our research. We are more concerned about low income, and so that's why we didn't. I think we didn't spend more time trying to really tease out the factors and the variables affecting high income, high income households. So yeah, I'm sorry I cannot give you a straight answer, but we didn't try it. But that's a good suggestion for next time we analyze the data and we ask questions. Thank you.
I'm not sure if I missed it, but did you ask people if they were eligible for same-day delivery? I know that some areas are not in same-day delivery or sometimes even next-day delivery fields for Amazon and other services. Is that something you studied?
Something that we didn't ask directly, but when we received the responses, we had the zip code of the respondent, and we did check that the zip code was within an area that had kind of same day, next day delivery access. Yeah, so we did it indirectly. We did not ask in the survey, but we checked later once we got the results. I mean, the responses. And yeah, that was the case, that most of the, I would say 99% of the respondents were within same day or next day delivery.
Gotcha. Thank you.
Yeah, I don't know if you can see in the Q, I don't know if you can see in the online Q&A, but we do have one question here. This person is asking, was household size also considered as a latent variable?
Okay, so household size was not a latent variable. That's something that we got directly from the respondents, and that was just a variable that we used in the model. Yeah, was not latent.
I wonder if you could clarify the interpretation of the latent variable related to income, because if I remember, you also had direct measurements of people's income levels, and so what would the latent variable of income actually represent?
Yeah, so that's a good question, and I would like to, again, I think the key issue was that delivery subscription was a very, very important variable in terms of expenditures and frequency and attitudes. But the thing was that delivery subscription was very, very highly correlated with also with income, and income was highly correlated with educational level and all the other variables related to number of workers. And so the main issue was that we had to do this kind of construct the model in a way that income was explaining the likelihood of having a subscription, and then the subscription was explaining the likelihood of having more or less deliveries. Does that make sense? So we assume that kind of causal link in terms of the more income, the more likely to have a subscription, instead of the other way around. The other thing we have said, well, if you have a subscription, then you're going to have more income. So we assume that households with more income tend to have a subscription, and then through the subscription variable, they are influencing the number of deliveries and expenditure. Does that make sense?
So it was a convenient mechanism to capture the correlations in that way you just explained.
Exactly. So it was a way to simultaneously estimate all the variables in one model. Yeah, exactly.
Thank you.
Andrea, Catherine, do you have any questions? So I have a question, Miguel. So for Oregon or Portland Pacific, what will be your key recommendations to city officials with respect to e-commerce? Do we need to foster it? Do we need to control it? Do we need to improve it to improve the accessibility and equity impacts? What will be your key takeaways from the research?
Yeah, I think that's a great question. It's something that we have been also kind of trying to answer, and when we presented this to to people in government, in the city, in the metro area, I think it's part of how to be prepared for next time, and in terms of making sure that all these equity push in terms of making sure that people have, it kind of makes sense that people have to have access to transit and to bike lanes and to the transportation infrastructure. But I think there could be a role for government, for example, to support the location of lockers, for example, to say, well, it's possible to say, well, if a business is willing to have a locker that many people can access, then that business could have some advantage in terms of some discounts in terms of tax rates, or some benefits in terms of additional parking, or something that the city or the region could provide. So it could be a way to make sure that there is a win-win situation, especially in places with the lower income and lower access to home deliveries. But that's a great question. But I think I think one of the contributions of the research is to recognize that there is an issue potentially, and that in a way to start thinking about measuring this kind of potential equity gap in terms of home deliveries, and to see how that is changing over time. So hopefully things will get better, but that's an open question, and maybe it's not going to get better. And then if it doesn't get better, then what can be done? And we think, for example, that lockers could be one way to help, but obviously there are many other things that could be done in terms of providing access, vouchers for low-income households, for example, to get a subscription and then be able to use e-commerce in a way that they don't have to worry about delivery costs. Yeah. So there could be many potential policy issues that can be related to addressing this issue.
Thanks. Any other question? Andre?
Well, I have a last one if we're not like out of time. It's a question I've been thinking of, and it is related to what you just asked, actually. I'm not sure if I'm gonna phrase it right, because I've been thinking about it. But so a lot of the locker locations are really highly correlated with high education, younger working adult populations. Are there any other like potential locker locations that we can think of, like policy-wise, efficiency-wise, that would help make them more accessible to all other of the like non-income demographic like sectors that you've identified? Where else can we put lockers?
Yeah, so I think that trying to answer your question, I think it's obviously if Amazon is installing them, it's because it makes sense for them. It's not, obviously they are good for the environment, and they have good overall effects on the population and on emissions. But I think Amazon is kind of, if you look at the distribution, it kind of makes sense that they tend to be in places with higher income, more education, just because people are ordering more and there are more deliveries, and there is a higher need to have lockers in those areas. It's kind of a self-fulfilling process in the sense that, more income, more money, more purchases, more deliveries, there are more lockers. And that's what we see in the data. So if I could show you a map with the kind of population distribution weighted by number of deliveries, then I think that the locker distribution would make even more sense, in the sense that there are more in these high delivery areas. And that's beneficial for, like I said, for Amazon and for any other logistic company, in terms of it's good for them to deliver more and faster with less vehicles and less people, so cheaper. So I think the challenge is again that on the consumer side is like lower income households tend to be in areas with other low income households that tend to order less online. So there is less demand for e-commerce, and that means that there is less of an incentive for companies to install lockers because it's going to be used less. So I think that's kind of breaking that cycle is the challenge in terms of, finding these locations where with a little bit of help, maybe from government or some incentive, then they can be provided with this type of facilities, for example. Yeah. Does that make sense?
So the same issue as like EV charging location.
Exactly. Yeah, yeah. It's like a catch-22. Yeah.
Right, right. Thank you.
Yeah.
Yeah, my question is a little bit like slightly off the research topic, but it is mainly on like these broader picture trends of like e-commerce has clearly won a lot in the pandemic, whereas retail locations have lost a lot during the pandemic. And do you feel that given the propensity of like low income folks to not really use these like e-commerce models, do you see this like compounding effect of like loss of accessibility as retail locations close and e-commerce dominates the market? Like, do you see that in the future, or is that something that there are other effects that may like play a role?
Yeah, that's good. Great comment. Great question. So I cannot answer with the like kind of scientific answer in terms of data, but I think that's just based on anecdotal evidence I see, and kind of relates a little bit with the findings in terms of if you think about now with working remotely, people working from home, those people, for example, may now, continue with more online and, e-commerce and more deliveries. But at least what I have noticed, and again, this is anecdotal where I live, that because there are more people working remotely, in this kind of white collar or the people that, can have professions that can work remotely, there is also more business for local kind of restaurants and places in the neighborhood. But at the same time, if you think about other neighborhoods where maybe there is less white collar, but more blue collar, more people that do not work from home, but really have to go somewhere else, then you see that the dynamic in terms of e-commerce versus local, purchasing and services could be very different just because people have a different way of moving around and connecting activities throughout the day. And going back to the lockers, I think sometimes it's hard to see how, the reality in terms of how lockers can be convenient. For example, this is anecdotal too, but just talking to a single mother that have to work and cannot work from home, so have to go to work, having a locker is a super amazing solution, because this mom was telling me, well, if I didn't have a locker, I risk, someone taking things from my porch or from, when it's delivered. And having a locker is great. Like, I don't have to worry about someone being at home. I can be gone and the delivery is there and I can pick it up when it's convenient. And, so I think that's the locker situation that could be beneficial in terms of, I guess, providing access, for example, for someone that is blue collar, cannot be at home and do not feel safe in terms of having the delivery, just left there unattended for many hours. And then, could be a kind of great benefit to have a locker. Yeah. So it's, I don't know if I answered directly, but again, just trying to provide some anecdotes and linking this with the working from home and how, many different households and have very different kind of, very different problems. Yeah, basically, like, talking to this single man was, very eye-opening in terms of, I hadn't realized how important was the locker for this person.
Okay, we are on a Friday, and I think people want to go out on their day. So Yeah, thank you so much. It was really interesting, and I'll talk to you soon.
Thank you.